Hello, everyone. I'm Dr. Diana Bitner, Chief Medical Officer here at True Women's Health, with my partner, Dr. Egan.
Hi.
Just like we do a deep dive in people's healthcare, we're going to do a deep dive tonight into what we do at True Women's Health and why personalized medicine we feel is the wave of the future.
And I think it's really important because to even talk about in a sense that, when we first met, I think one of the things that we bonded on was our passion for really taking care of patients. And not only that, but the constraints we felt with the system, right? We both wanted to do it in the what we felt was the right way with a lot of enthusiasm and structure. And we felt so confined in our previous roles that we had. And that's why we left our jobs to do what we do now. And I think it's just important to share some of that. And that's what we're hoping people will get out of this talk tonight.
I love that. And, please, everyone who's here, feel free to ask questions about any of these topics. But yeah, like I really loved what I did in terms of connecting with people and really being able to do that deep dive, and not only just having that curiosity and making sure that people feel heard and seen, and which is so satisfying for both, but to make sure that we could develop some process around that. And innovation isn't usually a hallmark of a large system, and it's really hard to steer the Titanic. So, I get it. It's easier to be small and nimble, but again, we want to talk tonight about what is concierge medicine, what is personalized medicine, and really provide some clarity around that and get to share the joy of what we do.
Yeah, awesome. Well, let's get started.
Sounds good. So, what is true women's health? It is all of this stuff together: internal medicine, weight loss, midlife menopause, and sexual health. It's a deep dive into providing these aspects of medical care without silos. So, all of this together by trained providers.
What I always make a joke because people ask me this question, and I'm like, it's primary care, but like answers to the questions that people actually care about, right? Not just checking some boxes, but these were, you and I sought our extra training because we're just trying to answer the questions that women brought to us, right? And
Right.
that's what
Like,
led us to seek more answers.
yeah, like people would ask me, why am I tired? Why don't I want to have sex? Why am I having hot flashes? Why am I gaining weight? And I'd be like, at the time, I don't know. I deliver babies. I don't know. So going to the first women's health meetings and then really starting to explore the literature and what's known, like we know so much about this. It's just how do we then really understand it, explain it in a way that makes a difference and be able to answer people's questions. But I love too what you talk about, that in internal medicine, you saw a lot of people with chronic disease that never had that opportunity to prevent it, right?
Yeah, definitely. And, a lot of the traditional primary internal medicine or primary care is disease focused, meaning they'll say, okay, great. Now you have type 2 diabetes. Now we're going to like dive deep into things. Or now you've already had a heart attack, right? So now let's like really get involved. And it just felt so backwards, right? Why are we waiting until people have these chronic diseases when let's get started at the beginning and let's talk about where people are at and maybe how they've made a small twist towards being less healthy. And let's jump on this now and sort of pull all these tools together that we need to sort of see where people are at and how we can make their lives better.
Well, and again, even just being able to predict, like, I never want someone to say, a woman who had a heart attack, like, oh my God, like, why me? Or as in, like, um, I didn't know that I could have had a heart attack. Where if we could look back and say, of course she was going to have a heart attack with all these factors. Like we
Mm-hmm.
know so much now that we can predict these things,
Mm-hmm.
that no women should suffer having that without, again, the opportunity to prevent that. So having said that, as we both chose to leave the system, it took a lot of courage. This is new. It's a new business model. We have a membership-based practice, meaning that our patients pay a membership, which allows us to spend more time, to have greater access 24/7 on a texting service. And that membership allows us to do what we do best. We have a brick and mortar office where we see people in person, but we also use a lot of digital solutions like texting and like telehealth.
Yeah. And I would say, a membership-based practice is not something new. It's not something that we made up. That's been sort of standard of care now for several years within the primary care space. It's even being expanded into a lot of even other fields like orthopedics and
Dermatology.
dermatology. So by no means is this something brand new that we came up with. We love that we have both the brick and mortar office, where if you need to come into the office to be seen and have a good cry, we are like here for you. But at the same time, if your kid is sick or you're traveling for work, we're also there for you. And we love both those options. And we sort of pride ourselves in trying to be as flexible as possible with people,
Right.
which isn't always the case with the big system.
Yeah, and we have patients from all over the state. I had several visits today with people who are on the east side of the state. I'm licensed in 2 states. You're licensed in how many now? 11?
So
Yeah.
7, yeah, some number, ridiculous number like that. Yeah.
And so again, for our patients who are traveling, we can legally do telehealth visits in other states. So it's really important to us that we have these digital solutions that allow us to take care of people where they are when they need us. And also it's having fewer patients. Again, the membership model allows us to spend more time, but we want to cap at a certain number of patients so we can provide that good care without people feeling like they're just someone in the system. And we can have get people in quickly when they need to be seen. And again, really, we know our patients. Someone calls in, I'm like, oh yeah, so-and-so. So, we're able to really know who's part of our practice.
Yeah. And I think what's, forgot is some of the art of medicine. Medicine is a relationship, a patient-physician relationship. That's what this is supposed to be. And if you have 3,000 patients, it's very difficult to sort of get to know someone on that level. And that really means a lot, not just to have that sort of care, but even in decision making, because you learn different things about people. And as time goes on over their lives, you may make a different decision about maybe a test or how you would send them to the ER or not, based off of different aspects of their life. And again, that takes time to develop and to get to know that person.
Right. And it's knowing not just their medical history or their cholesterol level, but who is their social support? What are they afraid of? We can make recommendations if it's made in a vacuum and we're just saying, unidirectional care, right? Where here, do this and we're out the door, versus let's have a conversation about this and make this shared decision making. People talk about that in theory. We do that every day. It's a partnership. It's a conversation. It's a discussion.
Yeah.
And having said that, it's sad that this is innovative, but this is innovative. It's bringing, what people really want, what we as providers really want into the system and innovating around that. So that's why we created True Women's Health. And there's such an unmet need. Just in terms of menopause, there's 60 million women that enter menopause each year. That's like 6,000 a day. There's only 1,300 certified menopause practitioners in the US. So, unfortunately, menopause has been around since, of course, people live past 50,
Yeah.
but yet all the aspects of menopause care have been largely ignored for a long time. And not only, of course, are there symptoms, but there's the health consequences of menopause. But, 75% of women are looking for solutions. 80% of women have symptoms that severely affect the quality of their life. And these women spend about $2,000 a year on ineffective solutions like over-the-counter supplements or a cooling blanket or, whatever. And they're just not getting the care that they need. So patients aren't satisfied, but also providers aren't satisfied. Like doctors and nurses and nurse midwives, nurse practitioners, PAs out there in the system. Sometimes it can be easy to say, oh, they just went fast or maybe they didn't listen, but they're working in a very stressful environment. It's hard.
We've been there. So, we've been there in a sense that, we've seen the administration come down with the hand on the watch, right? To say, you got to churn and burn these patients. There's actually a term for it. We say like churn and burn these patients fast. And again, that's just not the way that I wanted to practice. I definitely know it's not the way you wanted to practice. And especially if you're churning and burning patients all day, to be able to open your mind to some new ideas about maybe weight loss or menopause. I mean, you just don't have as much mental capacity to do that because you've burned through 30, 40 people in a day. And I
Yeah.
don't think it's ever in how the craft was intended to be.
No. And yeah, just to even read articles or go to medical meetings and learn new things. And, that's a challenge. And it's really important that we have people who are delivering babies and doing
Absolutely.
procedures and in that world. But again, that's where it takes all of us. And so we're not all supposed to remember everything, know everything. So again, this is why I think it's important that we have specialties, but people deserve team-based care. They deserve conversation between specialists. They deserve all of us to know what's going on. So again, having this model, I like to say if we're going to send you to a specialist, we want to babysit that referral. We want to make sure that you get there, that you're happy when you're there with the specialist we might refer you to. We're communicating back with that specialist. And then we want to know that you're satisfied with that experience with that specialist, or we'll find a different specialist. Like, we want to make sure that we've got a good team around you that's going to provide good care and good conversation and good explanations.
I'm even thinking of a patient within the past couple of weeks that I saw who went to see a specialist. We sort of immediately talked afterwards and we changed the plan, and we made sort of a pivot, not because that was wrong, but it just didn't feel right in the moment. And it was just so awesome to get this woman what she needed right away. And, having the time to do that, really, it feels great to get things move forward for patients.
Yeah, I love it when people are like, thank you so much for calling me. I'm like, isn't that what I'm supposed to do? Right? Like, to call and chat and make sure that we're on the same page. So anyways, again, I think, we've really found the sweet spot where we feel satisfied as providers. We're doing a good job. We're able to spend the time. We're able to know our patients. Like, I love my job. This doesn't feel like work. And then again, our patients are very happy and satisfied.
All right. So we've talked a little bit about this already, but when we think of a kind of a modern primary care office, again, it's much more focused on disease focus versus prevention. A lot of in and out, that turn and burn that we talked about. The traditional model is you see your doctor maybe once a year, right? You guys come up with a basic plan. Maybe it involves some medications, maybe it doesn't, right? And then they see it the following year. Holy smokes, a lot can happen over 12 months. That feels really long. Traditional primary care, even what I learned in my residency, is a lot of medications. Don't get me wrong, I love medications. Anyone who comes to my office knows I'm ready to suggest a medication, but by no means is that the only way to sort of do preventative health. It's not the only way to treat chronic disease. There should be other aspects of your life that should be in consideration other than just medications. The traditional primary care office visit tends to be a bit what we'll call paternalistic, meaning, you come in, maybe you have a few comments about stuff and the doctor says, oh, this is your blood pressure and this is your plan, right? Versus a conversation of what are your goals in this visit, right? What are your goals for your health? And what do you think about some different ideas and how can we together get you to your goals, right? Which we sort of pride ourselves in trying to have patients feel a lot of autonomy or their ownership over their own health goals. And again, you just kind of, a lot of doctors sometimes will have a lot of patients, so it just doesn't leave a lot of time to get to know that patient on an individual level.
Right. And it's almost like the, healthcare standards. We know that a blood pressure of 120 over 70 or less is the best, right? So, but that doesn't mean at 130 over whatever, here's a med. So it's the same thing with menopause. Not everybody wants to take hormones. Not everybody wants, again, it's all about what that patient wants, and it's being able to have that conversation. And, I like how traditionally a lot of times things take time between a symptom and a diagnosis and a treatment plan. And again, with our time and care, we're able to move faster. Another thing, very few touches with each patient. Like you said, a patient might go in once a year. We like to see people at least 3, if not 6 times a year, even just to stay in touch, to check on things, to follow. And we're able to use tools to follow along with symptoms. We use metrics versus just generally, how do you feel, but actually metrics to track progress.
And one of the things that, again, sort of gets forgotten is our job as physicians yes, is to get people to live longer and get people's blood sugars under better control. But honestly, it's to provide care and empathy. And even the touches that, Diana and I talk about, a lot of the times we'll just reach out and say, we're thinking of you. We know that this has been hard. We know about your life. Like, how are you? And that's really doctoring, right? As much as we love getting numbers under better control, really why we do this is to provide care for people. And that's what we think of as sort of a meaningful interaction. And if trust me, we always love to get those numbers better, but we really truly care about providing you empathy and having you as a patient feel cared for.
And I think part of that empathy is the teaching, right? Like, people are smart, and it's explaining what exactly it is that's going on versus, your blood pressure is high. So, for example, why is this specific medicine needed? Or, why does someone have insulin resistance? Or why is someone gaining belly fat? It's like going through the whys. People want to understand their body. And, one time I said, and it just popped out and it made sense. Like, I want people to know their bodies better than I do, right? In terms of menopause symptoms, or for you with obesity and metabolic health. It's like, we want you guys to know what's going on in your system. So then things make more sense in terms of why there might be a recommendation or why something isn't going to work. And so we don't want you to waste your time, but then why something else might work. So again, it's that teaching, it's that conversation, that relationship. Oh, thank you, Carrie.
Yeah, Carrie's very appreciative. And we also love, it sounds really odd, but we love that you guys can text, that you feel like you can get your message across, and that we can then address it really quickly. I mean, we don't like our patients to stew, right? I do not want you sitting there being like, oh, should I say something? Should I not? I'm in pain and I don't know what to do. Like, we really do want you to reach out so that we can address your concern right away.
Right. Well, and that's also like, if somebody's sitting and worrying about something, it will take 2 seconds for me to say, okay, yes, I'm worried. Let's do something about it. Or no, I'm not worried because of this and this and this. Mm-hmm. And so it can save you a lot of worry. It's something that I probably have seen 20 gazillion times and can just provide some clarity around that and help you make a decision. So again, I love it when people text in and say, oh, so sorry to bother you. I'm like, A, that's what you're paying us for. And B, that's what we love to do. And that's how we love to practice medicine. So again, we're just so fortunate. I just love our patients. And here we are.
Yeah. All right. Let's talk a little bit about some facts, because even though we say we like numbers, here they are. When this model initially came out, I would say it's been out for about 10, 15 years or so. A lot of people were like, no way are people going to do this. No way are people going to want to pay extra money to have all this time. Like, it just doesn't make any sense. But, as the years have gone on, more and more research supports that for the most part, people are pretty satisfied with the care that they're getting.
Pretty satisfied, 98%.
That's pretty satisfied, right? It's pretty good. Not only that, but they actually reduce the total amount of money that they spend, which I would agree with. There's so many times that a patient will text in, I will call them back, and my staff will alert me, and they're like, oh, I was going to go to the emergency room. I'm so glad that you called, right? And it's like, oh my gosh, that was like $5,000 we just saved them, right? With that just little phone call. And of course, we can never guarantee that that's something that we are not going to say, but just the interaction and trying to get you into the right people at the right time, we do think that that's going to reduce costs, but instead of just that bing bonging around sort of to different specialists to kind of find an answer, you really do have us there to sort of quarterback these sort of next steps through your health journey.
Right. And just like you said, research has linked concierge medicine to a reduction in hospital admission. So not only having to pay for the hospital admission, but unfortunately, being in the hospital, there's an increased risk of infection just by being exposed to other viruses and bacteria, right? But yeah. So if we can get ahead of things, that's the other thing is it's hard to put a cost reduction on prevention, right? Because there just hasn't been enough studies about preventative care, perhaps, and reduction of risk of heart attacks in terms of cost. I know there are studies, but in terms of enough of this happening, but we can see in the short term that cost is reduced. So yes, there's might be more cost up front, but yet in terms of the membership, but in terms of overall cost per year, It really does make sense.
Yeah. So I think that these are sort of interesting statistics that are come out. And I think over the next probably 5 to 10 years, we'll continue to gather more research kind of moving forward in regards to sort of what this atmosphere looks like.
And so then we talk about even more so, what do we do here at True? So, at True, number one, you've got providers who really care. Suzanne, Dr. Egan, and I, we're curious. We want to know. We love what we do, but also it's putting method around it. So our process of care is unique. This is something that I initially came up with, and with Dr. Egan, it's gotten even better. It was putting a method around it. So I see healthcare as like a financial plan, in the sense of you go to your financial planner and say, I want to retire with $1 million. And then with your planner, you have a conversation. Is $1 million enough? Can I get by on 500,000? What is the goal? So
And
here at True,
Dr. Bitner, I'm even just to think about that, extending it. One of my favorite things that you say is, what that financial planner will ask you is, well, what do you want to do in retirement? Right? Do you want to travel to Europe every month, or are you just going to sort of chill at home? Right. And I think that is a very great question in terms of your health that we ask patients. And I think that I know we talk about that a lot at our clinical meetings, of bringing that up again and again with patients, so that not only do we understand where patients want to be, but they can understand what they want to be, and spend some time to critically think about, how they see the next years, decades of their life.
Yeah, I remember when I first would be thinking about this, back in the day when I was delivering babies, and I'd sit in the call room, and while people were pushing, and I would think about, like, how do I want, healthcare to be? And I would think about, like, this woman, like, how did you want to be when you were 20, when you were 30, like before life got crazy busy with all the pressures that, a lot of us experience? Like, how did you want to be? Let's bring back that freshness, bring back the dream, bring back the possibility, because a lot of this is still possible. The dreams get lost in that every day. And so this plan was, how can we quantify this? How can we make metrics? How can we keep everyone accountable? Not only for you to keep yourself accountable to your goals, but also for us, your healthcare team, to help keep you accountable to your goals. So in all these different areas of wellness, it's about, what is your goal? Where are you now? So we talk about picture of self is where you want to be, how you picture yourself at a future event. And then your place and process is, where are you now? What is the gap? If there's a gap, if you're not where you want to be, what are the barriers? Are the barriers knowledge? Are the barriers family history, medical history of diabetes? So, for example, if you take phase of ovarian function, F, we look at the metric of a 3 means you're right, you're awesome. You have few hot flashes, you have lots of knowledge, your score is good on the MTS, the menopause transition scale. Everything is good. Most people, that's what they want. But let's say you come in, your score is 13, not 21, which is the max. Your symptoms are very unpredictable. They're interfering with your life, and you're 1. Your place and process of 1. What is the gap? Untreated menopause. What are the barriers? Let's look at all this knowledge, awareness. And so then we evaluate, what are the treatment options. So again, there's method around what we do. So it's not just a lovely visit and you leave and say, that was lovely, but what did we actually do at that visit? So I love this method for all these reasons. And Celia, when we first met, what was your first impression?
I mean, I think the first impression was that it was very all-encompassed, right? So not only are we talking about the things that over time, we may check some boxes off of in traditional primary care, but it is all the things that I would see in the office that I did care about as we sort of marched down that list. Some of the things that I would say traditional primary care cares a lot about. Cancer. I think a lot of doctors talk a lot about making sure women get their mammograms and colonoscopies and cervical cancer screening, but not necessarily that next level of, like, what's your family history? Would you be a candidate for genetic cancer screening? Definitely, things like your ability to be active, fit, ease of coping. I mean, that kind of stuff just isn't discussed sort of in great detail. And it's just so great that it's all laid out for a woman to sort of work her way through with her provider.
Right. And what's really interesting too, part of the goal with this was to be able to triage, right? To really figure out what is the issue for a patient. I'll never forget, I had a patient and I did a pilot study of this in 2008. And that's what the book was written about, was the story of the pilot study. But I remember I had a patient who in every area of wellness, she wanted to be a 3, her ability to be active, obesity, cancer risk, diabetes. We went through everything and she was a 3 in every one of the areas except income security. And income security, she was teaching, but she always had wanted to do music therapy. And she wanted to have a master's and she wanted to be able to run a program. And so part of it was her income security was limited because of her education. And she was afraid, what if something happened to her husband? Would she be able to take care of her family? And so, of course, we don't want to know anyone's numbers, but have you thought about how income security, feeling safe with what you have, affects your overall health? And this created a lot of worry for her. She didn't sleep well because she worried about this. And so we were able to get to what was her issue. And because of this thought process and a medical program, she went back to school, she got her master's, and she went back to the same school running the program 2 years later, and her health was complete. And she fully had her picture of self by her 50th birthday. So it's really cool that it helps people delineate what exactly they want to focus on.
Yeah, I think it's a great backbone to sort of get started with a lot of different topics. And we hope to see more of our patients, kind of use even this language to be like, all right, I'm coming in for G, right, to talk about my bones. We're all here for it and ready to talk about it.
Exactly.
And Anna made a comment that she's only been our patient for a month, but she's excited about it. Thanks.
Awesome. Thanks so much for sharing that. Then the next thing is, once we get through all of these, go back, Missy, if you would, just real quick, I forgot. So when we go through all these areas of wellness, it's then our goal is to offer you your life action plan. So in each one of the areas, it's a piece of paper that's all the areas. What is your goal? What is your picture of self? What is your place and process? What are the barriers? And what's the plan? So you have this life action plan, just again, like a financial planner would say, save more, spend less. Where do you want to put your money? Where do you want to invest? So it's this whole plan. And again, it can be modified. It's your plan, but it's something we can use as this backbone. The other thing I think about real quick is this is a checklist, right? So just like when you fly in an airplane, the pilots go through a checklist. We want to do the same. We want to have you to have a checklist for your health, because I don't think that your care should depend on the level of training of the provider you see. And so let's say your provider is not well versed in cancer risk reduction or high risk screening for breast cancer. You have your checklist. So wherever you go, if you see us at True or somewhere else, you're able to say, hey, this checklist hasn't been met. I need to see a provider who can give me a good discussion about risk reduction. Heart disease. Boy, I didn't have a CAC. I don't know my lipo(a). Like, what is there still out there that I need to make sure I have a thorough health plan? So again, maybe I'm getting too into the weeds, but I just love what we do.
Yeah, I mean, I think the summary is that, a lot of this obviously takes time, more so than just an individual visit. And that's what a piece of what we hope that people feel that they're getting when they're paying extra money is, if they want to do this, just an outline to sort of spend that time and review some of these options.
Perfect.
Awesome. So in addition to sort of having a plan to sort of move through your different aspects of life and goals, we sort of have a basic, I would say it's like a platform to sort of get started. It's been coined SEEDS, or the 7 essential elements for daily success. And it's all these different areas of wellness that we think are great to sort of focus on and provide you an outline if you're like, where do I even begin? Right? How do I even begin this journey? And here it is, right? We're going to get you drinking some water, get you sleeping, thinking about vitamins, thinking about fiber, thinking about different aspects of your nutrition. We want to get your body moving, and then even taking some time to quiet your mind and sort of reconnect your mind to your body.
Well, I came up with this years ago because women would say, just isn't there a medicine for this? Like, isn't there, like, how can I just feel better now? How can I? And it just kept hitting me, like, it's getting back to the basics. I think we think water will just happen, or sleep. Maybe I don't need that much sleep. So this was an evidence-based list that we, came up with years ago. And I remember just sitting around the round table trying to think of a name. And this just came out of a group conversation probably back in 2005. Shout out to Deidre back in the day. And it just really stuck. And I think it's a good list to go back to. For example, here I am, a hormone guru, and I'll still get a hot flash. I'm still wearing my patches. I'm still, I'm doing all the things. But if I get a hot flash, I go to my list. Did I drink my water? Did I get my sleep? I stayed up too late. Did I eat some sugar? Yeah, we had some really good treats at the office today. Did I work out? I gained a little weight. So again, it's using these to not only a checklist for our health, but to understand why we might be having some symptoms.
And I think, we've said this before, we don't want this to be a finger wag, right? Women got a lot on their plates.
No shame.
It's coming at them in a lot of different directions. We understand and get that. This is just gentle reminders, right? We say you can put it on your fridge, put it next to your bed, right? Even picking one once a week to be like, this week I'm going to focus on sleep, right? Like, I'm going to really prioritize trying to get to bed on time, right? Less Netflix, less work, more sleep, right? And maybe you put activity on the back burner, right? If you're getting up every day at 4 a.m. to do a 2-hour workout, maybe your body just needs some sleep this week, and that's okay, right? And you can kind of pick and choose the different things to focus on if you don't feel like all those things at once is a good idea.
Right. Hey, Amy, thanks so much for the shout out. I went from avoiding going to the doctor to looking forward to going because of True. Dr. Egan has changed my life. So grateful. And
thanks, Amy.
That's so lovely. Thank you, Dr. Egan. But it's so fun because people will say, is it weird that I look forward to coming to see my gynecologist? And it's just, we really, again, we have a lot of fun. And people want to know what's going on with their bodies. And again, it's very satisfying to go into that. Hey, Carrie, less media time. Yes, ma'am.
Yeah. All right. I think that's all we had to talk about. We're going to move on to our tips.
Our takeaways. Yeah. 5
takeaway tips.
Yeah. So number 1, what is your health worth? So I must say, sometimes I still feel almost apologetic in the sense that people have to pay for this. We all deserve this kind of care. So right now in the situation, the healthcare situation we're in, to get this kind of care, there is cost for us to keep the lights on, for us to provide this kind of care without just insurance, what insurance will pay for a visit. It does cost more. But we think about, number 1, what do we spend on other things, on creams and potions and lotions and an extra shirt. And what's really interesting here at True, how should I say this? There's people of all socioeconomic levels that come to a concierge practice. Some people save their pennies. For some people, it's not as much of an issue in terms of saving up for this. But again, it's how much is your health worth to you? In the end of the day, even if you spend a year with us, like it's about really taking care of yourself and prioritizing.
Yeah, absolutely. All right. Number 2, does your provider really know you? Right. So again, this is supposed to be a relationship. That's how the craft was sort of created, right? It's supposed to be a bond between 2 people that we can move a patient's health forward, that they can provide you care. And we hope that no matter who you're saying, if you go to the doctor, that you feel cared for and you feel like you have a good plan moving forward.
Yeah. Do you feel seen? Are you really able to be? And I think that's the next one. Do you feel heard and seen? As a takeaway tip, that to know that you deserve that, when you're doing something as deep as your healthcare and dealing with symptoms and problems, it's really important to be heard and seen, not to be brushed off as a number or a cholesterol level.
Yeah, absolutely. And then Jennifer says, Dr. Bitner is so encouraging, and she's learned so much about her health and menopause, and she's happy to have a personal healthcare experience. Thank you for that shout out.
Thanks for sharing.
Yeah.
Huge compliment from Nurse Jennifer.
Number 4, do you have a plan for your health in all 10 areas of wellness? We believe every woman should feel her worth in a sense that she should have a plan for all those 10 areas. And maybe the plan is not this year, right? I can't I got kids, I got a job, I got ailing, parents, maybe exercise, an aggressive strength training exercise program is not me this year, but that's okay. That's your plan. It's so helpful to revisit just at least once a year to sort of run through all these different areas and make sure there's not any barrier that is worth tackling sort of at this time in your life.
Right. I remember I had a patient who we went through her categories, and again, like in her plan for B, she was really okay with her weight being in the obese category. She was very comfortable with her weight. But she really didn't want heart disease because her father had had a heart attack. She had seen him suffer, and she's like, I don't want heart disease. So over time, it became clear that she chose to lose some weight because she knew that would impact her heart health. But again, it was her decision for a reason that really mattered to her, not just she thought she should lose weight. So again, every woman deserves to have a plan and to really be able to do some deep thinking about what you want.
Yeah. Sherry, thank you so much for your shout out too. She's really appreciative of all of our partnership that we have here at True. So thank you so much for sharing your thoughts about us. We love taking care of people. All right, number 5. Do you feel at the top of your game? So Dr. B, I know you hear this a lot. We feel a bit surprised sometimes because we're so proactive about women, that women will come to our office and they're just like killing it right at life, doing all the best things they can at work and doing the best things they can for their children and their families and their parents and all these and their partners. And yet they feel terrible. And you're like, oh my gosh, like, how are you doing so many amazing things? And yet you're exhausted and you're not eating, like maybe not eating at all, maybe eating everything, right? Like not working out, not sleeping.
Right.
You deserve better than that. And we want you to feel inspired to make even small changes for you to feel better. And not because you should do better at work, not because you need to be a better mom, not because you need to be a better partner or wife, just because you deserve to feel better.
You deserve to feel better. Like some people say, well, yeah, I guess the hot flashes aren't that bad. I'm like, really?
Yeah.
It's okay to set the standard high. It's okay to ask for things to be okay. Like I think especially, let's say with the perimenopause and menopause, like changes slowly happen and people kind of get used to, feeling tired or exhausted or can't get through the day or I'm not sleeping well or I don't feel sharp. Did you know that 20% of women leave the workforce in early menopause because they don't feel good? Here they are supposed to be right at the top of their game. They're wise. They've learned. You're the experts in your field, and yet you don't feel good. Like if I didn't feel good, I couldn't do what I do here at True. I don't have time for that stuff. Like I want to feel great, and I want you all to feel great.
And I think even too, thinking about women's sexual health, right? Even I think, again, libido is something that can slowly just sort of creep down over time. And if that's fine with you, that's awesome. But maybe it's not fine with you. Maybe you have some kind of small barriers that are there that we can fix to make sex more enjoyable. And you deserve that if that's what you want.
100%. And people just say, well, I guess that's just what happens because I'm getting older. Or they'll say, my doctor says, not many people have sex over 50. So, you're all right. Really? Yeah. No, it's about what you want. And it's about us being comfortable talking about it.
Yeah, absolutely. All right. So if you can't see us in our office, here's some questions you should take to your primary care doctor to see if they're up to your snuff.
So number 1, we always bring this up. I want you to be able to ask, what is your phase of ovarian function? Because truly, if someone is in perimenopause versus menopause, it just means different things, not only for symptoms, but also for medical management, for risk reduction. Menopause is the most dramatic risk factor for obesity and diabetes and heart disease and dementia. And so we've got to know these things. So you should be able to ask this.
And they should be able to give you a fair answer. All right. Number 2. What is our strategy for healthy aging, right? We hope that it's a little bit more than just checking the basic primary care boxes, right? Like you got your mammogram check, like move on to your 50, right? We hope it's a little bit more than that. But they should have a pretty decent strategy for you to talk about some aspects of preventative health because that's becoming more and more clear. That's an important part of aging.
And again, I think the first part of that is, are they asking you what you want?
Absolutely.
Yes. So
all right.
Number
3.
It's you being able to ask, what are my options to treat menopause symptoms and what are my risks? And again, it's to confirm that they are certified in menopause, or at least have a good understanding or have been to the menopause meeting, because again, I don't think your care should be limited by the level of training. So if menopause isn't their thing, that's okay. But just say, hey, who would you recommend I see who is trained or well-versed in really good decision-making about pros and cons of treatment? Not just saying all estrogen is bad or all this is good or whatever. It's really having a sense of what is up to date, what is evidence-based, what is safe.
And this is a true area of medicine, which sounds really bizarre to say, but there's research papers, there's standards of care. And what a doctor should not say to you is, well, like my mom had breast cancer, so therefore I don't give anyone estrogen. That's not an appropriate answer in terms of answering any medical question. And menopause symptoms they're part of medicine, and they deserve every level of care that we would provide with any other symptom or sort of human body process that's out there that we've learned about.
Yeah, and everything is related. Hot flashes are linked to depression, are linked to obesity, are linked to low sex drive, are linked to heart disease. Like everything is related. So again, it's asking your provider, are you looking at me as a whole person and how all of this interacts?
Yeah, great. Number 4. Am I missing any screening tools? So believe it or not, one of the things that we feel as though people are paying for with their concierge membership is we try to stay really up to date on anything new that's out there, right? Not only are we trying to be innovative, but we're trying to make sure that there's no innovation that we're missing. And we take a lot of time vetting different things. So we don't offer everything in our office because there's some things that we don't feel are worthy for you guys to do. But there's a lot of things that are, and that we believe very strongly in. And that just takes time to reach out to these companies to sort of figure out if that makes sense, read the research papers that are surrounding some of the data that they're presenting, and then getting it functionally into our office for you and available to do. Dr. Egan and I talk a lot about this.
Well, even how you initially brought Gallery to our office, Celia, and that's just been amazing. We've had over 300 tests for Gallery, and Gallery is a blood test to tell if you have a cancer. It screens for a cancer today. Mm-hmm. I'm saying that too quickly. It's worth a whole nother hour of discussion.
Yeah,
but absolutely. Again, it's getting into these, genetics. How do you process medications? We currently do the Gene Site, which looks for how you process a medication like antidepressant or anti-anxiety medication, but soon getting into more tests that look at how you might process a statin or a narcotic. So again, personalized medicine to me isn't just these tests, it's how do we put these tests then into the picture of your whole person. So again, this is an awesome question for you to ask.
Yeah, great. 5, what are your thoughts about a preventative approach when making medical decisions? So again, disease focused, right? We don't want to wait till someone has a heart attack before maybe we're going to write them a statin. We don't want to wait till someone has full-blown diabetes before we write them for a kind of a simple drug like metformin, right? If you have uptrending blood sugars, things that aren't in the right place, your weight's been uptrending, let's be proactive about this instead of waiting until you cross these sort of fictional thresholds. The conversation I have with a lot of my patients is traditional medicine, a lot of it was based off infectious disease. Infectious disease is very black and white. You either have tuberculosis or you don't. You either have pneumonia or you don't. Metabolic health, inflammatory disease, vascular disease, all these things are a bit of a spectrum, meaning you're kind of shifting down, back and forth in the spectrum. And if you're headed in a direction of being less metabolically well, meaning your body just doesn't handle energy well, it's not taking that food in from your diet and processing it in the right way. Let's get on top of this now before you sort of cross these just cutoffs that we sort of have made, to be really proactive. If you have a doctor that sort of doesn't even want to have that conversation, maybe you need to look
doesn't have time.
Or doesn't have time. Maybe look for someone who's willing to be a little bit proactive, particularly if you yourself have already tried some basic stuff, right? If you've already tried to sort of eat healthier or, add an exercise plan and it's still not working, you got to get someone that's maybe going to be a little more proactive with you.
Exactly. And, I think that also brings us to talking about our team. We're very proud to announce that our team will be expanding. We're adding 2 new providers starting in October. And we're so excited because, again, we haven't ever wanted to overpromise and underdeliver. We currently have a waiting list. This was not a sales conversation tonight. We're very busy. We're very happy with what we're doing. We just want to share more and more of what we do. And again, we're so excited to bring providers that are very similar to us. They're normal. We love normal. They're lovely, and they're very smart. They're very curious, and they're excited to join a small system here at True, to join us in doing what we do. So in the months to come, we'll be introducing our new partners, and again, really excited to do that.
Yeah. And I would say, I think a lot of it's that they reached out to us, right? To say, hey, they're looking for something a little bit different than just sort of the standard traditional model. And that's who we're excited to bring on, are people who are open-minded and excited, enthusiastic about patient care.
And they can't wait to learn about menopause and become certified in menopause and do more and more on obesity medicine and metabolic health. So, we're just so excited, and just with more great minds, we can ask more questions, be more curious, bring more cutting edge things here to all the patients that we get to take care of. And we're really looking forward to helping to transform women's healthcare. And we really hope that this discussion clarified a bit more about concierge medicine, about True Women's Health. We hope you check us out, ask us questions, send us messages to the website, or give our office a call. So again, thank you so much for tonight.
Yeah. And if anything, if maybe our office isn't who you want to go, or you're not in a state that we practice, just feeling encouraged that you feel proactive to take your hands on your own health, and maybe even just get Dr. B's book, just to get started with your own outline of your own waypoints.
Or Dr. Egan wrote the Nourishment Journal. So but it's awesome. Like, I've walked people through it in the last bit since we've started to have them in the rooms. And this Nourishment Journal is about your ping to eat. And every day you can track what you ate and why you ate it, so you can really start to understand your pattern. So again, we just want to provide these tools so you can understand things better, and we can all move women's health forward together. So,
all right.
Thank you. Be well.
Yes.